This is the opioid crisis. The opioid crisis started as a misuse of prescription drugs such as pain relievers, heroin, and even fentanyl. Opioids is a term used for the entire family of opiate drugs, including natural, synthetic, and semi-synthetic. Typical opioid drugs are heroin, codeine, oxycodone, etc. This began in the late 1990s when pharmaceutical companies ensured that patients would not become addicted, resulting in doctors prescribing larger doses at larger quantities. According to the National Institute on Drug Abuse, every day in the United States, more than 100 people die from misuse and overdose of opioid drugs. In 2015 alone, more than 33,000 Americans died as a result of an overdose, and in that same year, roughly 2 million people were found to be misusing and abusing these drugs. A panel described the opioid use disorder as a predominant symptom of social despair. The people typically most affected are white communities without college degrees. Peer pressure and social experiments are the typical reason younger people become addicted. Addiction is higher in the lower age population and rising each year. On a 60-minute interview, Bill Whitaker states that the opioid crisis has been the most devastating public health crisis of the 21st century. Whitaker believes that drug distributors are responsible for the alarming crisis that has affected this country. According to the CDC, the number of opioid prescriptions dispensed steadily increased from 112 million in 1992 to a peak of 282 million in 2012. The 21st Century Cures Act, passed in 2016, allows $1 billion over 2 years in opioid crisis grants to states, providing funding for expanding treatment and prevention programs. In August of 2017, Attorney General Jeff Sessions announced the launch of an opioid fraud and abuse detection unit within the Department of Justice. The mission of this is to prosecute individuals who commit opioid-related healthcare fraud. This graph shows the amount of deaths that drugs have caused since the year of 1999. Even our youngest members of our society have not been exempt from this crisis. Toddlers and young children are increasingly being found unconscious or dead after consuming an adult's drug. Pregnant mothers are given other opioids to ease their addiction, but put babies at risk for withdrawal, causing doctors to rethink their treatment. Opioid-dependent newborns are even at more of a risk. Babies are experiencing withdrawal symptoms as young as 24 hours old. The CDC has begun focusing their work by building prevention efforts by equipping states with resources, improving data collection, and supporting the use of evidence-based prevention strategies. Collecting and analyzing data on opioid-related overdoses to better identify areas that need assistance and to evaluate prevention efforts. Supporting healthcare providers and health systems with data, tools, and guidance for evidence-based decision-making to improve opioid prescribing and patient safety. Partnering with public safety officials, including law enforcement, to address the growing illicit opioid problem. Encouraging consumers to make safe choices about opioids and raising awareness about prescription opioid misuse and overdose.